If you take 10,000 IUs of vitamin D3 supplement daily, are you at a risk of overdosing? How about 20,000 or 30,000 IUs of vitamin D3 supplement daily? So, in this video, I will answer all these questions based on a couple of excellent medical research papers. These papers were published in the Clinical Endocrinology Journal and are linked in the video description below. 16 patients with vitamin D toxicity were observed and treated for a period of 2 years. These patients were referred to the endocrinology department because they were suffering from hypercalcemia. Now, hypercalcemia is a condition in which the calcium level in your blood is above normal. Too much calcium in blood can weaken bones, create kidney stones, and interfere with heart and brain functions. Hypercalcemia is a very serious condition that usually occurs in folks who overdose on vitamin D3 supplements. So, here is the $1,000,000 question. How much vitamin D3 supplement is considered safe? To answer this question, we have to look at the vitamin D serum levels in healthy individuals. The NIH and US government define vitamin D serum levels above 20 nanogram per milliliter as adequate for bones and overall health in adults. But this information is severely dated and obsolete. Modern research shows that vitamin D plays a crucial role not just in bone health but also cancer prevention, depression, type 2 diabetes, cardiovascular diseases, weight loss, and even multiple sclerosis. This is because vitamin D is actually a hormone. Our bodies synthesize vitamin D from sun exposure and it gets activated in the liver and the kidney. This activated form of vitamin D acts as a hormone and it boosts our immune system and helps subdue various autoimmune disorders. But our bodies need at least 50 nanogram per milliliter of vitamin D serum level to experience all these benefits. Unfortunately, most adults in the United States, UK, Canada, and even tropical countries like India, they have much lower levels of vitamin D. And this should not come as a surprise because our ancestors were hunters and gatherers who spent most of their time in sunlight. But we mostly stay indoors, and even when we get out, we are told to wear sunscreen to prevent skin cancer, which unfortunately also blocks the very UVB radiation that is needed to synthesize vitamin D. So if the goal is to maintain a 50 nanogram per milliliter vitamin D serum level, you have no option but to take vitamin D3 supplements. Now, if you follow the NIH and the US government's guideline for recommended dietary allowance of vitamin D, it's impossible to reach and maintain a 50 nanogram per milliliter vitamin D serum level. Their recommendation is to take only 600 IUs of vitamin D daily and never exceed 4,000 IUs. So that's a ridiculously low number, and it explains why half the population in the United States is deficient in vitamin D. The problem with recommended dietary allowance for vitamin D is that these low values were established a long time back when vitamin D was thought to be only useful for calcium absorption. But now we know that vitamin D does a lot more for you. Now, I personally take 7,000 IUs, but depending on where you live, the color of your skin, your age, weight, and many other factors, you may need a higher dose of vitamin D. But how high can you go before it becomes toxic and potentially cause hypercalcemia? Vitamin D serum levels above 150 nanogram per milliliter is usually considered toxic. The Institute of Medicine concluded that doses below 10,000 IUs per day are usually not associated with toxicity. So anything below 10,000 IU is generally safe, but taking 50,000 IUs or more per day for several weeks or months is frequently associated with toxic side effects, including documented hypercalcemia. But interestingly, not all cases with high serum levels greater than or equal to 150 nanograms per milliliter manifested in vitamin D toxicity. In a study conducted on 21 patients with serum levels over 150 nanogram per milliliter for a period of 2 years, only 16 patients developed vitamin D toxicity, whereas 5 patients were asymptomatic. Various other studies have also shown that patients with vitamin D serum levels anywhere from 100 to 150 nanograms per milliliter did not always develop hypercalcemia. So the bottom line is that vitamin D toxicity is rare and it only happens when you take 50,000 or higher IUs of vitamin D3 supplements daily. But the good news is that most folks don't need such a high dose of vitamin D3. Personally, I am able to maintain a healthy 50 nanogram per milliliter serum level by just taking 7,000 IUs of vitamin D3 supplement daily. But like I said before, there is no one size fits all solution. So you will have to get your vitamin D levels tested and consult with your doctor to identify the correct dosage for yourself. Now, if you are wondering about common symptoms of vitamin D deficiency, check out this video over here. In this video, I go over 3 most common signs of vitamin D deficiency. So please watch this video to find out if you suffer from any one of these symptoms. So take care of yourself and I will see you in the next video.